I'm Charlita Tavares, CEO of PrimaryOne Health. Annual meetings are a time to reflect, adjust, plan, and prepare for the next year. 2019 was a very good and productive year. Thankfully, since 2020 has hit our healthcare, social services, business, and economy with a serious blow. A year so far in which we have all had to pivot in order to continue to serve our patients, customers, consumers, and clients, as well as our practitioners and staff, and you, our audience. However, we will delve into this at our 2021 meeting. I would like to thank at this time our outstanding board of directors, led by our chair, Candy Pringle. We are fortunate as an organization to be led by our customers, our patients. As a federally qualified health center, 51% of our board members must be patients who direct our policies, approve our budget, determine when, where, which services, and what hours we will operate. In addition, they approve all grant submissions, partnership agreements, and bring the patient perspectives to the board of directors. In 2019, PrimaryOne Health brought on 5 new board members: Thomas Adams, Russell Barney, Robert Benson-Haver, Ed Morgan, and Maria Ramos. Last year's annual meeting was held at the Columbus Metropolitan Library, where we greeted many friends, public officials, and community-based partners in Central Ohio. You might see yourself on those slides. We celebrated healthcare champions, both internally and externally, with Ms. Deborah Diggs, a healthcare advocate and community activist, and our own Vision Services Director, Dr. Greg Graves, who epitomizes the servant leader and patient-focused practitioner. We focused our strategic objectives on expanding our partnerships with Southeast Healthcare Services and the Adam H. Board of Franklin County at a new innovative practice model located at 720 East Broad Street. We were selected by the Ohio Department of Job and Family Services as one of 5 refugee screening programs in the state in partnership with the Ohio State University. A new partnership was also established with Alvis and Comp Drug at a new location in the Driving Park community at 1289 East Livingston Avenue. Diversifying our funding portfolio, which saw an increase in grants of more than $2.3 million. In addition to increase our sustainability, we were able to generate a $1.2 million surplus for our rainy day reserve fund. As many know, we are experiencing the storm now with the 2019-2020 COVID-19 pandemic. And developing promising and innovative practices while taking home first place once again at the National Association of Community Health Centers Community Health Institute in Chicago. We have won first and/or second place in 3 out of the last 4 years. Our patients, they spoke and we listened. We extended hours at 2 additional locations on Saturday, East Main Street and South High Street, from 8 a.m. until 5 p.m. And we work with our pharmacy team and contract community-based retail pharmacies to save our patients more than $16 million, almost $17 million, and our 340B, with our 340B prescription drug discount program. And we also collaborated once again with the Mid-Ohio Food Bank to conduct our Produce Connect fresh fruit and vegetable distribution at our East Main and West Broad Street locations for our patients and community members. Finally, we could not have accomplished any of this without strong management and direction from our senior leadership and their teams. Dr. Jeff Marable, Chief Clinical Officer, Michelle Ingmeyer, Chief Operations Officer, DeWitt Harrell, Chief Financial Officer, and John Tolbert, Chief Community Services Officer. I now have the pleasure of introducing our 2018 through 2020 Board Chair, Ms. Candy Pringle, who also happens to be a patient board member.
Good evening, and welcome to the 2020 annual meeting of PrimaryOne Health. I am Candy Pringle, Chair of the Board of Directors, and I want to welcome you and thank you on behalf of the board for joining us as we share our 2019 year in review. I want to begin with a quote. Our highest calling in life is to thrive and flourish, and not just survive. During this incredibly challenging time, we must do our best to thrive. That quote comes from Donald Iannone, a doctor of divinity. Let us share a moment of silence for all of our family members, colleagues, friends, and others across the country who unfortunately have lost their battle with COVID-19. I would like to introduce my fellow board members and officers from 2019 until this evening's meeting. Jacqueline Downey, Chair-elect, Dr. Celeste Asphalt, Secretary, Samantha Sam Schuler, Treasurer, Thomas Adams, Russell Barney, Robert Bensonhaber, Geisham Littell, Ed Morgan, Maria Ramos, Ada Sanchez, Ben Sears, Emily Fisher, Special Advisor, and myself, Candy Pringle, Board Chair. In 2019, our more than 300 employees across our 11 health centers had another banner year. I am delighted to report that our teams provided services to more than 48,000 patients, our highest yet. Our visits were nearly 176,000. Wow, just outstanding. More good news, we successfully grew reserves in 2019, and we are thankful in 2020 to have them. I would like to share a few of our many accomplishments in 2019. We opened a new site in partnership at 720 East Broad Street with Adam H. Board and Southeast Healthcare. We opened the new Refugee Health Center with the State of Ohio and OSU. Opened West Broad Street Walk-In Clinic. Opened new site in partnership at 1289 East Livingston Avenue with Alvis Inc. and Comp Drug. Provided nearly $8 million in uncompensated care. Clinical pharmacy teams was published in the Journal of Primary Care and Community Health, and that was in November of 2019. We increased our partnerships by 20%, implemented new technologies designed to save the organization nearly $1 million. We won first place in the innovation category at the NAC conference in August. Pain Recovery Program chosen to present at the Ohio Association of Community Health Centers, National Association of Community Health Centers, and the National Council for Behavioral Health. Awarded the Government Financial Officers Association's Distinguished Budget Award. 340B patient prescriptions, cash savings topped $16 million total for the year. We received a clean 2018 financial audit and management letter, and more than 350 families were served, and more than 8 tons of fresh produce was given away. I would like to now introduce the slate of officers for 2020-2021. Myself, Candy Pringle, immediate past chair. Jacqueline Downey, chair. Samantha Schuler, chair-elect. Russ Barney, treasurer. Dr. Saleshi Asfa, secretary. And before closing, I want to show the board's extreme appreciation to our senior leaders, our senior managers, our amazing practitioners, our support teams, our outstanding administrative and operations teams for all of their contingency and emergency work this year. We have been successful in continuing services this year to date with more than 30,000 patients and more than 50,000 visits, with nearly 80% of those services via telehealth. Let's give a round of applause.
Thank you very much, Candy. And now I have the pleasure of introducing our incoming chair for the years 2020 through 2022, Jacqueline Downey. Jackie, can you join me?
Good evening. Thank you very much. On behalf of PrimaryOne Health, I would like to thank Candy for all of her service here. A little bit about Candy. Candy was a patient at PrimaryOne Health, and she was appointed to the board of directors in 2012 of December. In 2015, Candy became the chair of the Nominating and Governance Committee. In May 2016, Candy was appointed to a second term as director and elected chair-elect. In May 2018, Candy was elected to chair. Under the terms of the organization, under her term, the organization has moved forward and grown, just as you have heard. Candy, personally, I want to thank you during your term as chair for leading me and guiding me as how to be a chair. You've involved me in different parts that most chairs do not let the people behind them learn, and that has given me an insight that I would not have had, but for your comfort in giving and making sure the organization works. Candy, as a token of our appreciation, please accept this gift on behalf of PrimaryOne Health. And Candy is not here today, so our CEO is accepting it on her behalf.
Thank you very much, Jacqueline, and I appreciate all that you shared with the leadership that Candy has provided to PrimaryOne Health. Although Candy isn't here with us physically, we are going to present her gift to her at an upcoming event. Thank you all for joining us at the 2019 annual meeting, and we hope to see you again next year. Thank you.